All right, so I'm verifying my provider's orders, and I'm going to be cleaning and I'm going to be suctioning my patient's trach today. I'm looking at my tools, and they don't appear to be expired, so that's good. So we're good to go. So now I'm going to go ahead and enter my patient's room. So knock, knock, knock.
Hello?
Hi, is now a good time?
Yes.
All right, okay, thank you. Is it okay if I close the door for some privacy?
Yes.
So I'm gonna close the door for some privacy, and I'm gonna go ahead and put my stuff down, and I'll go for hand hygiene. Hi, my name is Bianca. I'm a full-time nursing student at Nevada State College, and I'm here today for Professor Tuxon. How are you doing today?
Hi, Bianca. I'm doing well. And yourself?
I'm good, thank you. So before we get started, can I verify your name and date of birth, please?
Yes, my name is Miss Teddy, and my date of birth is 12/12/69.
Perfect. So it coordinates. Also, do you have any allergies I need to be aware of?
I do not have any allergies.
Awesome, thank you. Do you know what brings me in today?
I think it has to do with my trach.
Yes. So today we're going to be suctioning your trach, and in that process, you aren't going to have any air coming in your airway for about 10 seconds.
Okay.
But it's just a suction, okay? Also, I'm going to be cleaning your trach as well, okay?
Alrighty. Is it gonna hurt at all?
No, it's not.
Okay.
So what I'm going to do now is I'm going to go ahead and prep everything, and then we're going to go ahead and start and get your suctioning going and continue from there.
Okay.
Also, I am going to be assessing your vital signs too. So I'm going to go ahead and prep, and then I'm going to go ahead and I'm going to assess your vitals.
Okay.
So I'm going to be connecting my suction to 80 to 120, and I'm going to be connecting my my ambu bag to oxygen, so I can go ahead and give you some breaths, okay, like you guys if you would breathe normally, okay. Also, I'm going to take your vitals, especially your respirations and your pulse oximetry, okay. All right, so now I'm going to go ahead and set everything up so we can begin to give you your oxygen and as well as your suction, okay. So I'm opening my kit, and I'm going to go ahead and take my sterile gloves, okay. Okay. Perfect. All right. So now I don't need this. All right. So I'm gonna go ahead, and the first thing I'm gonna do is I'm gonna give you your breaths, and I'm gonna connect the oxygen. Okay.
Okay.
So there is gonna be one hand that is gonna get dirty, which is gonna be my non-dominant hand for this process. Okay. So I'm gonna go ahead and get my oxygen now, and I'm gonna give you a few breaths, like if you were breathing. Good. Are you doing okay?
Yes.
Okay. Perfect. And one more. Good. Yay. Okay.
Thank you.
Perfect. All right. So now I'm gonna go ahead and connect it now. So I connected it, and now I'm gonna use my my sterile hand to grab my section. Okay.
Okay.
So I'm gonna go ahead and use my non-sterile hand on this part. So I'm gonna go ahead and I'm gonna go in no more than 6 inches.
Okay.
Perfect. And now I'm gonna do suction and circular motion less than 10 seconds. Perfect. Now I'm gonna take it out. Good. Okay, let's do one more. Okay. No more than 6. Perfect. And less than 10 seconds. Perfect. Good.
Oh my goodness.
Great job. Okay.
Thank you.
All right. So now that we've done the suction and all that, now I'm gonna go ahead, since my gloves are still good, I'm gonna go ahead and take off your old dressing, and then I'm gonna just assess the skin to make sure there's like no breakdown and none of that. Then I'm gonna redo sterile procedure again when I'm doing the cleaning process, okay?
Okay, sounds really good.
So I'm taking this off,
Okay.
and this is trash. Perfect. I'm looking at your skin, and your skin appears to be good. I don't see like any redness or breakdown or ooey gooeys back there.
Okay.
Good. Perfect. So I'm gonna go ahead and discard these gloves because they're no longer needed. Okay. perform hand hygiene. Okay, let's go ahead and start everything over again, okay?
Okay.
So, I'm gonna go ahead and perform hand hygiene.
Okay.
So I got my kit. And here's my sterile gloves. So I need to grab my kits. And I'm just gonna put this out because I do need 3 sections. And then I'm gonna be taking the inside of your trach and cleaning that part too, okay?
All right, sounds good.
So I'm gonna go ahead and I'm gonna add my water and my. Let me put my gloves on. I apologize. I'm gonna do the hand hygiene again. Sorry. So I'm gonna go ahead and put my gloves. Okay. Okay. Oh. I'm struggling a little bit with these gloves, but we're gonna make it.
They make those gloves really hard to get on, huh?
A little bit. It's a little hard. Sorry about that.
That's okay.
Yay! We got them on.
Yay.
Perfect. All right. So I'm gonna go ahead and discard of this as well. Sorry about that.
No worries.
Also, I'm gonna go ahead and open this, and I'm gonna prepare my sterile film.
Okay.
And I'm gonna add my water to my sterile film,
Mm-hmm.
and then my kit. Okay. And now I'm gonna go ahead and add the water
Okay.
and the 3 components. Okay.
Okay.
So I don't need this one just yet. Just put this in my sterile film. Okay. So before we get started, I do need to assess your vital signs one more time. Okay, so I assessed your vital signs, everything's good. So now let's proceed with the cleaning, and since I already have everything set up. I'm gonna go ahead and I'm gonna use my non-dominant hand by the tip. I'm gonna take it out and put it in the water. Okay, so I'm gonna get it and I'm gonna use this to clean the inside. Perfect. And let's do it again. Perfect. So now I'm gonna put this to the side and let it dry. Okay. And then, okay. Now that it's dry, I'm gonna put it back in, okay?
Okay.
Good job.
Thank you.
Perfect. So now that that's good, I'm gonna go ahead and I'm going to head and clean underneath. So I'm just gonna loosen it up, and I'm gonna go ahead and make sure that all the gooey are out, and I'm gonna be using my Q-tip. So go behind it. We did behind it. Perfect. Trash that. And now I'm gonna do the plate of it.
Mm-hmm.
Perfect. You're doing so great. So
Thank you.
That's good. I'm gonna go ahead and tighten it. Before I tighten it back up, I'm gonna add my your gauze again. Okay.
So what does the gauze do?
Oh, it's to protect your skin.
Oh, okay.
So now that I'm putting that back in, you're doing so good.
Thank you.
You're doing great. Perfect. All right. So now I'm gonna tighten it, and you're doing good. So all done now. All right. So before you have any, do you have any other questions before I go?
No, I don't.
Okay, but before I do leave, I just gotta do one more thing. I just gotta check your vitals. All right, good. So your respirations and all that are good. And now I'm gonna go ahead and take off my gloves, and I'm gonna perform hand hygiene. And I'm gonna put your bed in the lowest position, and your call in and reach. If you have any other questions, please let me know. And I will be back in an hour to check up on you. Thank you.
Okay, thank you.
Bye.